is a 25 years old with a road traffic accident with distal femur fractures. These are his x-rays and these are his CT scans. Debate going on that what is the way of treating these kind of fractures. Whether to do a plate on one side to go with the time. So options are these. So lateral locking plate is a common, maybe treated as a alone, which we are treating many times. The lateral locking plate plus taints on the medial side. The lateral locking plate and iron nail. Lateral locking plus medial plate, that means dual plating, or any other options like assisted external fixators when you get a compound fracture, but it's not a compound fracture. So, Sangeet, what will be your option?
Can you go back to the CT of the X-rays?
Yeah.
So, here, if you fix the intercondylar part first, then you can go ahead with the supracondylar nail and a bridge plate, probably by a MIPU, and avoid all the combination.
So nail and plate,
yes,
it's your choice. Swapnil?
So the TARPA approach, as the distal part of the femur is not comminuted, if I am having option of distal multiple interlock option nail, then I will go only for IMSC also.
Only I am nail.
Yeah, IMSC, I mean retrograde nail with interfragmentary compression of the fracture.
But can you get the purchase of the locking bolts of the nail here? Because if you see that there is anterior, posterior, everything is void. If you see this is a 3D CT, I don't have probably the 2D CT which will give more comminution on the medial side.
I think the part where I am going to put the IMSC screws, this and this are quite intact.
So that will only 2 screws will be accumulated in
That's
there.
what I'm
Only
saying.
2
If
screws.
I get a multiple interlocking screw with 2 interfax screw,
Okay.
3 screw through the nail in oblique direction, 1 or 2 interfragmentary screw for the intercondylar compression, and then just slide the nail without getting that all the pieces gross anatomical reduction, because it is metaphysical condition.
Nadimani sir?
The span of the fracture is a large fracture, and therefore what I will do, articular reconstruction, nailing and then bridge plating.
So nail plus plate.
Yes.
With the nail alone, the construct is too elastic.
Yeah.
That is
So
the-
I did this. Okay.
हमारी सुना.
Is this okay, or is going to do something to fail something?
I think it's perfect and it will unite, no problem.
It is going to fail?
It will unite.
Because you taken care of all the forces, angular forces, rotational forces, taken care of. In a span, in a long span.
Okay. This is next one. This is next one again. This is again next month. And after 1 year, you see this date, and the treated date is 22. If you see, it took 1 year for healing this fracture. Okay. Initially, the period was very small. So what my conjecture is, this becomes a very rigid fixation. That becomes a very rigid fixation. If you see, the medial callus is formed because of that. There is some movement. That's why the medial callus is formed. But if you see the lateral side, that not much of callus is formed because it becomes very rigid. So putting a nail plate combination in a fresh fracture is to be taken very as per the patients and your learning of the biomechanics. So what we were now planning is, looking at this scenario, we are using a short nail. The nail is short. If you see this, the locking bolt in the superior part is gone from the plate nail and through the nail. So it becomes excellently stable, but it's very rigid. So you require some sort of some micro motion to form callus. So I would now treat with this to get a. So the callus is formed well, there is no doubt about it, but it takes a lot of time. So this is function. So the take-home message is you have to have a C2 and C3 fractures. CT is mandatory to rule out your fragments. Now the dual implants are must. You cannot have a one plate or any type of plate which will be helpful, but you should have a dual implants. So you may choice maybe a locking plate on the lateral side. I use now TENS, this is very common now. But if this void is more than 3 centimeters, then I use a nail plus plate, which gives you excellent stability on that. But definitely there will be a delayed union, and the time will tell if the more number of cases. And the dual plate should be avoided. As per my concern is because I don't use a dual plate for the day one. If it is more than 4 centimeters, 5 centimeters void, and we are looking at the only void on the AP X-ray of the whatever X-ray are taken. We have to see the CT view.
Sunil.